Hi, my name is Dr. Saib Gallagher. I'm a plastic and reconstructive surgeon here in Miami, Florida. And in this video, I'm going to talk about knee lifts. It's not a very commonly requested surgery, but I have to say, in the times I've performed it, patients tend to be incredibly happy with it. Now, what type of patient typically gets a knee lift? So I've done this in isolation where we're just dealing with the knee itself, or more commonly at the same time as addressing the rest of the leg, usually the thigh, and a thigh lift as well. And so typically the type of folks that get knee lift surgery fall into two categories. Usually it's folks who've lost a lot of weight and have a lot of loose skin, which can in some patients gather around the knees themselves. Usually there'll also be loose skin on the inner thigh, and oftentimes it will do a thigh lift and connect that incision to where we're doing the knee lift surgery. But sometimes in some folks it's just around the knee itself, and typically in that case we're going to design a crescenteric type incision just above the knee. It blends in quite well with the folds, it lifts up the extra skin, and oftentimes if there's fatty deposits there, we'll do some liposuction as well. The second group of patients we do this commonly in are folks who have a condition called lipedema. And so lipedema is a condition not many people who have it know that they have it, and in fact 11% of people who are assigned female at birth can have this problem. And how you know you have it is all your weight typically goes to your legs, and interestingly, whatever it is about the fat in lipedema, it's incredibly difficult to get rid of. So that's where surgical techniques like what I mean get rid of through normal diet and exercise, normal weight loss, this fat is very resistant to that. So that's where surgery comes into play. If there's not too much there, usually just liposuction really helps, but if there's loose skin as well or a lot of tissue there, sometimes we may have to do a knee lift at the same time in order to tidy up the tissue around the knees. Usually, depending on what we're doing, not too much downtime with this procedure, typically about a week off work. Typically we do some dissolvable stitches. We may have a patient wear a garment if we're doing some liposuction as well. I never use drains in any of my body contouring procedures, and a knee lift is no exception to that. So it's a cool little procedure. Not many people know about it. Like I said, the most common time I do it is when we add it on to a thigh lift, but definitely worth knowing about if your knees bother you.